So upper respiratory, just a minute, the upper respiratory tract infection. So respiratory system, we are going to give it two approaches. We are going to look at the upper respiratory tract infections, and I also want to look at the lower respiratory tract infections. So when we talk about the upper respiratory tract infections, we are talking about infections that are affecting the nose, the sinuses, the pharynx, that is the throat, the larynx, that is the voice box. Basically, those infections that affect the structures above the vocal cords, above the larynx, those are the upper respiratory infections. Generally, we are looking at what is this that causes these upper respiratory infections, and most of them are viral, but we'll have some that are bacterial, and those that are viral, we'll be looking at most of them are caused by the rhinovirus, which is the most common cause of the common cold that we know. We have others like the adenovirus, the coronavirus, the influenza virus. All those are some of those viruses that cause the upper respiratory tract infections. Then we have those that are of bacterial origin, like I've just said, though they are quite few, but we like those caused by the Haemophilus influenzae, Streptococcus pyogenes, which is Agrupae strep throat. That's still a bacterial infection. So some of those infections, most common, they are just like I've said, most of them are viral. Outside bacterial, Haemophilus influenza, the S. pneumoniae, the C. diphtheria, some of those bacteria that cause the upper respiratory infections. Most of the upper respiratory infections are classified according to the part of the upper respiratory tract that they affect. Laryngitis that affects the larynx, the epiglottitis, the laryngitis, the pharynx, the otitis media, which affects the ears, rhinitis, diphtheria. So most of these are basically classified according to the part of the upper respiratory tract, the respiratory tract that they affect. We look at the symptoms. Of course, we'll come to each individual of them, but of course, you have those common symptoms for all of them, like the sore throat, the runny nose, sneezing, cough, which are headache, which are common and cut across all these upper respiratory tract infections.